It's 2 o'clock. I'm Olive Martini, and it is the Working on Wellness Radio Forum that we do the second Wednesday of every month. And this is part of the Dungeness Valley Health and Wellness Clinic. And my guest in the studio today is Petra Reininger. She's the Olympic Area Agency on Aging, their information and assistance specialist. And she's going to be talking about what you can do if you're at home alone, and we're going to be talking about caregivers and all that kind of stuff. Welcome, Petra.
Thank you. I'm so excited to be here today.
Well, tell us a little bit about your background and how you got into this.
I was a caregiver for my mother. She had dementia, and she pretty much was insisting on being independent until one time she had an accident, and then I knew, okay, I have to move. So I was living in California at the time, and I moved up here, and I became a 24/7 caregiver for her. And from that, I used O3A, that's the nickname for, or shortcut for Olympic Area Agency on Aging. I used their resources, and I joined a caregiver support group, which was really a lifeline for me being new to the area. They provided resources that I didn't know anything about, which made a big difference. And in addition, they were a safe outlet for my frustrations because, as a lot of people know, when you're away from it and not seeing it every day and you just jump and do caregiving, sometimes you don't know what you're jumping into. So having that support group was a real great lifeline for me. And from that, evolved my passion toward helping others in this area.
Well, we're going to be talking about an awful lot of interesting things to do today, especially if you live alone. Mm-hmm. And what's the biggest obstacle to achieving your retirement dreams?
Well, one of the most important assets we have when we retire is our health. Our ability to live our dreams depends on our health status. So for most of us, though, our life expectancy is much longer than our health expectancy. In reality, 2 out of 3 of us will encounter a health concern during our retirement. So the biggest threat to anybody's retirement is uncovered long-term health care costs. And we don't discuss this enough when we make retirement plans. Most of the plans that we do create look like Swiss cheese. There's a lot of holes in them. So one of the things we want to talk about today are how can we make sure the plan is more inclusive and includes various elements that help with caring in the long term.
So what components should be included in your life care plan to be successful? And how can you tell when someone needs extra support?
So what I call the golden years. You are the architect of creating that golden era for yourself. So imagine a pie and draw 6 slices. And each slice represents a component of your life or care plan. And that would include your care support team. That's slice number 1. Slice number 2 would be all your legal documents. Slice number 3 would be housing. Slice number 4 is health. Slice number 5 is finances. And slice number 6 is your attitude. So when I talk about your care support team, that's identifying people in your life who are important to you. And that could be your spouse or partner, certain family members, your adult children, your faith leader, your social worker, your attorney, your doctor. It could be close, trusted friends or neighbors. But you want to start a conversation with them about what's important to you, about your life and your health care. And it's a series of conversations you have that is going to help you create a care plan so that you have a support group with you as you age. Now, a good resource to start that process is called the Conversation Starter, which is located on the website conversationstarterproject.org. When I talk about the second slice, the legal, it's the power of attorney, your health care directives, your will, and a couple other things. What's really important about that is that you, regardless of your age, if you have an accident and you're conked on the head and you're unconscious, nobody knows what your wishes are. So it's really important to get these documents done sooner than later. Communicate to the people you're picking as your agents during your life so they know they've been picked. And second of all, you want to make sure they're informed of the resource, because a lot of times people may pick a relative who's out of the area and they get a phone call oh, so-and-so's in the hospital, can you make these decisions? And they have no idea what the resources are in this area. So as you're talking and learning and going to workshops and hearing about these, you need to also make sure your power of attorneys are equally informed, so when it comes to a time of a crisis, they know how to respond. So I always, when I'm talking to people, that's one of the first things that I suggest to them. When I talk about the third slice about housing, your forever home or aging in place, it's deciding whether you're going to downsize, go to a retirement community, or you want to stay where you're living, and making sure it's safe. So you want to investigate, make sure your lighting's correct, make sure your carpets are such that you don't trip over them. If you need toilet risers, install them, safety bars in the bathroom, walk-in closet, ramps, wider doorways, all those things that make sure that your home is safe so that you can age in place. If your choice is to age, downsize, or go to another, that's also part of that planning. When I talk about health, we're talking about both living a healthy lifestyle, your diet, movement, mental health, social connection. That's really important as we age, to have that social connection. And also how your health insurance plans are. You want to make sure whatever happens, you're covered. So one of the things that our agency offers is the Sheba Clinic, which covers health insurance, and you want to check that out separately. Finances, knowing your finances and creating a budget. You'll be amazed how many people come in our office have no clue. And it's really important to know what exactly you have and don't have so you can plan accordingly. Attitude. That a lot of times one's attitude about the aging process makes a big difference on whether you're accepting of help. If you feel you're still 20 years old and can move like you're a 20-year-old, you're fooling yourself. And it's better to be realistic and admit to yourself, yes, I do need help when you do need help, rather than fighting it.
What's the biggest myth about Medicare coverage?
So a lot of people assume Medicare covers everything related to health care, and they think long-term care is the same as health care. Medicare gets involved when you have a health care incident, and it covers the cost to recover from that incident, including rehabilitative, but it's short-term. It's intended to help you rehab to get to the place where you were before you had your incident, or at least stabilize you. But Medicare is not designed to cover what's called convalescent or long-term or personal care. And that's a big misnomer, that people think, well, if I've been in the hospital, I get discharged, okay, Medicare is going to cover the cost to have a caregiver in my home. No, it's not. And we'll get further into what covers that separately.
So for long-term care services, how do people pay for that?
So there are 4 ways in which people can pay for long-term care services. One is you privately pay for it. Second is veteran benefits like aid and attendance. Third is private financing like long-term care insurance, long-term care insurance, reverse mortgages, life insurance policies, annuities. Those are more that you would talk to a financial planner to determine what would be the best way to do it. Only 6% of the population in the U.S. has long-term care insurance, so that most people end up relying on public long-term care insurance or Medicaid. So those are the 4 ways, and the veteran benefits, which is aid and attendance, or it's a combination of those 4 resources.
So what in-home care services are available through public funding?
So if you're relying on Medicaid or long-term care funding or state funding, we have 3 programs through our agency. One's called COPES, C-O-P-E-S. That's Community Options Program Entry System. Then there's the Tailored Support for Older Adults, and then we have the Family Caregiver Support Program. All 3 of them have 2 types of eligibility requirements. One is a functional eligibility, so you would need assistance with 2 daily living skills. And then there's a financial eligibility requirement, which would involve both income and your assets or resources. In all 3 cases, they don't look at your house as a resource, and they don't look at your car. If you want to know the specifics of it, then you can come to our office and we can explain to you, because the numbers change all the time. So it's just the main thing is to realize that you need to demonstrate that you do need help and that there is a financial assessment about that.
Talk about if you don't know you're ready, how do you know you're ready for a caregiver and the different types of caregivers that are out there?
So the different types of caregivers are your family. You have also informal caregivers like your neighbors or your friends and volunteers. And the main thing is they usually don't have any formal training. They're of good heart and they're volunteering their time. And then you have direct hire, which are people that are privately paid and they're in the market for themselves. And then you also have in-home caregiver agency caregivers, and you have state-paid individual provider caregivers. So on the in-home caregiver agencies, there are 9 agencies in our area, and 4 of them accept state-funded monies to pay for caregiving. Normally the cost for a caregiver through an agency is between $40 and $50 an hour. If you're hiring someone directly who's in business for themselves, it's about $25 to $35 an hour. But the difference is that an agency is going to have done the background check, has done the training, provides a backup if someone doesn't show up. Whereas when you're hiring someone privately, you're taking on the responsibility of doing the background check, the interviewing, and most importantly, the bookkeeping, because there's involved with taxes and things like that. So there's a plus and minus to either way. The state-paid individual provider caregivers, if you are on a state-funded program, the state does pay for someone to become a caregiver. It can be a friend, it can be a neighbor, a family member. The only person it can't be is your spouse, unfortunately. But they have to go through a background check and do some training and be certified. And then as long as the care receiver is approved on a program, then they can be matched together. When you're hiring someone privately, you do want to make sure that they are certified. So to be a caregiver in the state of Washington, you do have to be registered and certified. They do require some training involved. So you want to make sure you can ask them when you're hiring someone to produce their certification, either as a home care aide or home health aide. Sometimes someone can be as a CNA, and there are different levels of training to provide the care. So usually an informal caregiver is going to be more about companionship and running errands, anything that's non-medical, whereas when you get into a certified nursing assistant, then they can do under the supervision of somebody. But in between that area, it's just that they have received the training and know what they're doing. So whereas when you're informally, we don't realize sometimes that someone is caregiving for us when they are doing errands for us because we're homebound, or the neighbor's gone and picked up your trash and brought it back to the house. That's caregiving. You're taking a person to the doctor's appointment. That's caregiving. And it's informal, and because someone's good-natured about it, we don't label it as helping us because we can't help ourselves.
So what are some of the activities performed by an in-home caregiver?
So when we look at a caregiver, we would call it activities of daily living. So mobility is a big one because people, when they risk fall, that is probably the beginning of a downslide if you end up fracturing a hip or a femur or anything like that. So we look at mobility. You want to have somebody who can help you with doing your mobility exercises, or if you're relying on a cane or a walker, that you're doing it properly and they're there with you to support you with that. The next thing would be transferring, the ability to get in and out of a chair, whether it's without assistance or with assistance, so they can help you with that by providing leverage for you to be able to pull yourself up, especially if you don't have one of those automatic booster chairs. And the other one being able to turn and roll over in your bed, get out of bed, get off the toilet, that type of thing. Another thing they help with is toileting, especially if you have incontinence issues. Bathing and showering or sponge baths if someone is bedbound, dressing, and some people have problems with their hands or can't put their arms over their head, so they have problems with zippers and buttons and bending over to their shoes and socks, especially those support socks. Those are kind of tough, so having someone help you with that. So the personal care is a big part of it. and some family members don't like to do that, so having a professional do it is, easier on them. And the other activities would be medication reminders. Unless someone is medically trained, they are not allowed to touch and give it to them, but they can remind somebody to do that. And then you have meal preparation. Some people can't prepare meals anymore. They can't stand long enough in front of the stove or microwave to do it, or they can no longer feed themselves. Then you also have ancillary activities such as housekeeping, light housekeeping, such as vacuuming, dusting, making the bed, doing the laundry, doing the dishes. And then they can also go to the doctors with you. They can do essential shopping for you or take you on going outside to do that. And there's also companionship. Companionship is not part of the state-provided services, but for informal purposes or privately hiring someone, that can be included as far as your task list for a caregiver.
What are some of the questions to ask when you interview a caregiver?
So some of the things that you might ask is, where have you worked before and what kind of things did you do on the jobs? How do you feel about caring for an elderly or disabled person? Have you ever provided care for a person similar to what this job requires? How do you handle people who are angry or frustrated? Why are you choosing to do this type of work? What makes you uncomfortable or angry? What's your attitude about smoking, drinking, using drugs, or being on your smartphone while you're working? That's a big problem today. Is there anything in the job description that I've written which you would not do? What commitment do you have to staying on this job if you're willing to take it? And then you want to ask them for a couple references. And we have a handout at our office if you need more direction as far as how to prepare the ad or how to create the job description, how to interview and reference check. And most important, I feel, when people privately hire, they don't put it in writing. And I think it's really important to protect yourself and the caregiver that you put in writing what the understandings and expectations are for what is happening, because it is a contract, and that line gets blurred real easily when you're in a vulnerable place and you're relying on this person for a lot of things. Then you become friends, but it's really important to keep it also recognize that it's still a contract. And when you're hiring a caregiver agency, some of the questions you might want to ask the agency is, what type of screening have they done with their employees? Who's the supervisor, how they supervise them? And what kind of general or specialized training have they given to their employees? And who do you call if the employee doesn't show up? And what are their fees and what do those fees cover? What are the minimum and maximum hours of service? Because some agencies require a minimum number of hours per visit. They may have certain days of the week that they don't cover. In this area, it's hard to find a caregiver who will do weekends or evenings. And are there any limitations in the terms of tasks performed or times of the days in which the services need to be finished by? So those are some of the questions you could ask, either hiring privately or if you're hiring through an agency, because normally the agency will send out a supervisor first before the caregiver, so you want to interview the agency as well as the individual person.
Well, tell our listeners while we're talking about this, where your office is located, right next to KSQM, and the telephone number there for people to call.
360-452-3221.
Great. And we are in the shopping center right next to Fifth Avenue Furniture. If you know where that is, KSQM is right next door, and the Olympic Area Agency on Aging is right next door to KSQM. What do you do when you live alone and you need help? And how can you tell if someone needs help and they just don't think they're there?
That's very common, especially in this area, as we have more people coming up here that live alone and don't have support. So I want to address this in two ways. One is, what do you do when you live alone to create a way of support indirectly? One is, you can use the idea of, I'm going to open my blinds by a certain time and I'm going to close my blinds by a certain time, and you let your neighbors know, so if they don't see the blinds open at 10 a.m., they're going to come over and check to see if you're okay. and that's an informal agreement. Another thing that people do is they keep a texting ring. So sometimes people will text each other each morning and say, I'm okay. And if they don't get the text by a certain time, then they're going to call you. And if you don't answer the phone, then they're going to call, someone to do a welfare check. So that's another system. There are some call service apps right now that will automatically call you, and if you don't pick up, then they'll send you a text, and then they'll also alert whoever's on your contact list. So that's some of the things. So a lot of people also jumping to a side as far as appointing someone to be your care manager. In our area, we do have 4 private case management companies that if you needed somebody to be in charge of your affairs, need to do welfare checks with you, you can contact our agency and we can give you the names of those companies that provide that service for people who live alone and are concerned about as they age whether they can still manage their affairs. Now, how can you tell when someone needs extra help? Well, it's not always clear. Some people, they recognize it in themselves and they ask for it, or an emergency or a sudden illness comes about and then it's pretty clear. And then there's others who don't want to cause worry or admit that they're struggling. So the best way to know what someone needs is to ask them directly and to do it in person. Texting and emailing is, people can skate around that, but when you're face-to-face asking that question, you're more likely going to get an answer that's helpful. So some of the signs that indicate a person might need extra help would be like physically, are they wearing the appropriate clothes for the environment? Someone who's out in their PJs, or it's dead of winter and they're in short sleeves and, shorts, you'd have to ask the question. Are they having trouble walking around or getting around? Have they had a significant change in their weight, whether it's weight loss or weight gain? A change in eating habits? Are you noticing balance problems? Do they have poor hygiene, unexplained bumps and bruises? If you go into their home, do you notice unusual carpet stains? Excessive clutter is a real clue. Unusual odors, leaving the stove on after use, unkept yard, dents and scratches on their car. Emotionally, are you noticing mood swings, lack of motivation, loneliness, social isolation, uncharacteristic or abusive behaviors? Cognitively, do you recognize, are they repeating themselves a lot? Are they acting confused or showing memory loss, mismanaging their medications, unpaid bills? We all, as we age, have signs of forgetfulness. We forget we're wearing our glasses on our head, or we've left our keys in a different place, but we still know what they are. When it becomes confusion is when people forget what the car keys are for, or they don't know how to use the microwave anymore and they put their cell phone in the microwave. Those are things those are alarms. So anyway, those are the signs that you want to look for when you start noticing it, and then you want to have a conversation with that person. And sometimes they're a little resistant to talking about it. So I recommend that, how you phrase it's really important, and asking, hey, do you need some, I noticed you don't have any food in the house. Do you need some help going to the grocery store? Or can I arrange to have meals or your groceries delivered to your house? Your tone, your calmness, all that is implying concern, but not judging. And that's really important, how you phrase your questions to get someone to be open to what you're suggesting.
What do you do if someone doesn't want someone in their home? What do you do then?
I ran into that with my mom. She was very reluctant to having a stranger in the house. Part of it was, I think, it was an invasion of her privacy. And also, when you have a family member helping you, you can kind of wink and say, that's not really caregiving. They're doing because that's part of our negotiation that we have in our relationship. But it is an indication of loss of independence and the need that you need care when you have a professional coming in to assist with caregiving responsibilities. So it's important that the primary caregiver has a break and has time to relax and rejuvenate it, because the best caregiver is a rested caregiver. And if you push yourself and don't take breaks, A lot of times the caregiver develops illnesses, and then where is the care receiver? They are in a worse situation than if they didn't have a caregiver at all. So some of the things that I would recommend is start gradually, have the person come in a couple hours each week, and let that person build rapport, and as they feel comfortable and trusting, then you can add to the hours. The other thing is do listen to the care receiver's fears and responses for not wanting an aid. Ask and explain that you understand their feelings, and get them involved in the selection of the aid so that they feel more invested and comfortable with the decision. One that I used is, "This is for me, Mom. I know you don't need help, but I need help."
Yeah.
So that was another one. Another one that is a common one is, "This is being prescribed by your doctor." Because a doctor is an authority figure, and a lot of times a care receiver will listen to when the doctor does say you need help. I've used that one a lot. I need someone to help clean. Clean is an activity that's non-judgmental. It's not threatening. So I get a lot of people, "I just need someone to come in and do a little housekeeping." I know they need more care, but that's kind of the gateway to start the process. This is a free service. It's not costing anything. Because a lot of people are concerned, "Oh, we're wasting our money. We're not going to get our money out of it." Or you can introduce the aide as my personal friend. And they are a friend, and they are helping the caregiver, so they are a friend in that sense. Or this is only temporary. So sometimes it might be, and some people end up having to leave and go on vacation, and they want to be able to feel that they can leave safely and not have to have worry on their mind. So doing it temporarily as a start off, and then on the other side of it, all of a sudden, wasn't so bad. We can continue this. So it's a great way to segue into an ongoing program with the care receiver.
So what are the different options if staying at home is no longer an option?
So typically we get involved with in-home care services because we want to stay independent as long as possible. We want to stay at home. And I use the rule of safety as the deciding factor. If you do not have a support system and it's no longer safe, if you've fallen several times and been found unattended for hours on end and it's caused health issues, then that is a safety issue. And so then you need to assess a facility. Usually if you've done your planning ahead, you'll know what facilities are available. But if it comes about because you've had a medical incident and the decision is no longer yours, we do have 4 types of facilities to consider for long-term care, and that's adult family homes, which is more of a residence situation. It will have 2 to 6 residents. You're sharing a living room, a dining room, and a kitchen, and each person has their own room. Unless they're on Medicaid, then it's a semi-private room. And there the ratio of caregiving to resident is very good. It's probably 1 to 3, because there's usually 2 caregivers during the day and 1 at night. Then you have assisted living facilities, and this is more where you have between 50 to 99 people in the facility. They each have their own apartment. Sometimes there's studios or 1 bedroom or 2 bedroom, and you're paying for room and board plus care. So the pricing on it varies depending on the level of care you need. So a lot of people will go in initially just doing the room and board, and they want someone else to do their meals, and they can either have it in the room or in congregate dining hall. It usually will include housekeeping services and linen services, group activities and bus transportation, that type of thing. Then you have memory care facilities. They're like assisted living facilities, but they're locked down, and that's because people with memory care, one of the issues is people who take off and wander, and they are responsible for that person's care. So they do not want them taking off and nobody knowing where they are. That's a real concern. And then you have skilled nursing facilities, which we have 3 on the peninsula. And that is where not only do you have room, board, and care, but there is a medical staff. There's a medical director in charge of the facility. There's a nurse, an RN on staff. and then they have their own pharmacy. So the decisions for your medical decisions can be done at the skilled nursing facility. Typically in our area, there's a combination of rehabilitation when you've been discharged from the hospital or transferred over, or long-term care. They're usually combined in one facility. The majority of the facilities on the peninsula are for-profit, so most of them are private pay. Some do take Medicaid. And then we have very few nonprofit facilities in the area. So the average cost, if you're in an adult family home, or is approximately $4,500 to $7,500. For memory care is $6,000 to $17,000 a month. These are by months. And skilled nursing is between $14,000 and $25,000 a month. So they've really gone up in the last 5 years. It's kind of shocking. And for men, 40% chance of being in a facility, and the average time in a facility is 2.2 years, or costs about $225,000. And women, there's 72% chance of going into a facility, and the average time is 3.5 years, or $350,000. And because women age longer, develop a higher percentage of dementia, that's why that number is higher.
So what happens when you have a health crisis and end up in the ER?
Oh yes, we don't like that happen, but it does happen more often than we'd like to admit. Well, what happens when you're in the hospital, if you are in the ER, usually you do want to be admitted into the hospital. Usually they will admit you in order to stabilize you. And then there's one of 4 options. One, you would be discharged home. And then you can, when you're being discharged home as part of the care plan, they may order home health or hospice care. Both of those are covered by Medicare if the doctor has ordered it. They're both temporary services. So home health is for someone who is homebound, who needs an additional medical care at home. So it would be a physical therapist, a speech therapist, occupational therapist, a nurse to manage wound care, any injectables, that type of thing. And it can include a bathing aid that will come once or twice a week. Hospice care is if someone has a terminal illness and they have a prognosis of 6 months or less, then that would be a different kind of care, and the focus is on comfort and managing your usual and customary illness, but you're not going to continue on with extraordinary means. But both of those are temporary and paid by Medicare. The other next option would be you're in the hospital. If you are there for 3 days, that's 3 times crossing midnight, and you're transferred to a rehab center, and Medicare will cover that. And the first 20 days are at 100% by Medicare, and then after that, it's 80% on Medicare and 20% out of pocket or your secondary insurance. And usually that part of it is about rehabilitating. It's not, so your goal is to go home. And then again, the facility can order home health to help you transition home. And sometimes you end up going from home health to having an ongoing in-home caregiver. And then those resources are different from Medicare. Again, Medicare does not cover ongoing in-home care services. Then the other option is if you are in the hospital, you've been there for 3 days or more, you're transferred to a facility, you're rehabbing, and they've determined that your prognosis of recovering is not there and that you're going to need ongoing care and it's not safe for you to go home, then you become a long-term care resident. Then you are no longer on Medicare. You are now relying on either long-term care insurance, your private financing like selling your home or reverse mortgage or whatever, or you apply to go on public assistance like long-term care Medicaid, or you have VA benefits such as aid and attendance. So that's what happens when you have a healthcare crisis. And you can, if you know ahead of time, then that's what your options are. That's better off for you, because a lot of times I'll get a call from somebody who's in the hospital and they're ready to discharge, and they want to know how I can get them a caregiver the next day. It's not going to happen if you're relying on state-funded programs. Those are at least 60 days out. So
We've been talking about what can you do if you live alone and you're not ready for a caregiver, and you've had a crisis, you've had an episode where you're in the hospital and you've come home. What do you do after you've had an episode?
Well, be fortunate when you arrive home that you have a second chance to do it right. And the first thing I would do is assess your living circumstances. Make sure that you have the grab bars in the bathroom. If you need a toilet riser, your toilet's at the right height. If you need a pole bar by your bed to be able to help you get out of bed, make sure your bed's at the right height. If you need a booster chair in the living room so it's easier for you to transition in and out. If you need a walker or a cane, you can always ask your doctor to order home health to help you work with a physical therapist to learn to use it correctly so you don't incur additional aches and pains from not doing it correctly. And the whole goal is to be able to live longer at home, and with just a little help, that can be accomplished. And so there are resources in our community that can help you do that. So if you needed medical equipment to be able to, when you transfer from the hospital home, such as a commode or a walker, or you need scooter, or you need those type of things, we have in our community the Seroptimists. They have a medical loan closet. Volunteer Hospice has a medical loan closet. So they have an extensive inventory. It's just a matter of calling them and arranging that. If you need safety bars or a ramp installed and you can't afford it, you can contact the Aging in Place program at Habitat for Humanity, and they will make arrangements to have a ramp built, and they will talk to you about the financing or if it's at no charge to you. So there are resources that can help you with those things about making your home more safe.
So what's the best piece of advice you can give our listeners as it relates to care options?
Well, one of the best pieces of advice I received as a family caregiver is not to think that I had to do it all myself physically. Being a caregiver meant that I'm managing the care of another person. I could delegate some of the jobs to another caregiver. This meant that if for whatever reason I had to place someone in a facility, I wasn't abandoning my loved one, so I didn't need to be guilty about doing that. I'm not abandoning them. It just means I'm going to be advocating for them and caregiving for them in a different way. I will show up at the facility and have lunch or dinner with them on a regular basis, whether it's daily, a couple times a week, because it's very important that the facility see that family is involved with their resident. They still occupy a place in your thoughts and your heart, regardless of where they're at. So that's probably one of the best pieces of advice I got as a family caregiver. The other thing as a care receiver is asking for help. And another piece is for all of us, and that is to develop a care plan or a life plan. It is truly a gift for those who care for you to have that plan in place. Because, everybody's living their life, they're busy, and all of a sudden they get the phone call, so-and-so has had an accident, can you come up here and help, or whatever, and they're totally lost of what to do. And it creates stress upon stress. And I can't tell you how many times I've had family members thank their loved ones for having taken care of all of it. They put it all in a notebook, all their finances, or all their account numbers, all who to contact, what they want, what they don't want. It's all in one place, and it's so easy for them to deal with it. That is a gift that you can give your family members or whoever you've asked to be on your care plan. It allows you to live your best life and to how to complete your life responsibly. It plants the seeds for your loved ones to do the same thing for their offspring. I mean, it's the legacy my mom gave me, that I want to pass on. And that's such a big difference when you have done the plan versus someone who's chosen not to deal with it. So I want to close by saying Rosalind Carter, who started the whole family caregiver focus, said we are either going to be a caregiver, we are a caregiver, or we've been a caregiver, or we're going to be a care receiver. You're not going to escape this life without having been exposed to caregiving, so we might as well do it right and ask for help when you need help.
So if our listeners have questions about what they need to do next, they can call Olympic Area Agency on Aging at
360-452-3221.
And they're located right next to KSQM in the SQM, I forget what the name of the shopping center is, but it's across the street from Safeway, so you can't miss it.
Get renamed the Shipley Center.
It's going to be next to the new Shipley Center, that's right. So the Working on Wellness radio forums are always the second Wednesday of each month at 2 p.m. And the Dungeness Valley Health and Wellness Clinic puts this on. They're one of 32 free clinics in the state of Washington. The clinic is open to the public on Monday and Thursday evenings. The doors open at 4:30 p.m. and no appointments are necessary. The SQM Free Clinic serves anyone who has no health insurance or is underfunded by their health insurance policy. Petra, I want to thank you so much for coming in. This was great information. I hope you'll visit again soon.
Oh, I'd love to. It was great. Thank you so much for having me.
You're welcome.